back trying to do this powerful breath of fire, I found most people could not do it. Now with this part of your thumb, the lower base part, you're going to go up and down straight on the zygomatic arch. So it looks like that. Most people can't locate this. I'm not sure why. I've tried to train my family and they don't get this point. They kind of go up and down, but it's this way. Ear to nose, ear to nose, ear to nose. Again, about 20 seconds. Now, if you know anatomy, the left hand fits. There's like this little nice place it fits. And actually, the right hand is touching the forehead, and the other hand comes up like this. In the original tape, Yogi Bhajan was going, "You know no fear. You know no fear." I do not do this on 99% of my patients because they're not yogis and they're not ready for that, at least in my practice. But I'll hold this point for about a minute and just, it's a very comfortable point. Your hand just fits right in there. So if you know this glabella, you're just right on it with this thicker part of your hand and the other hand on top. The next procedure I would do would be to sit the patient up and adjust them. All right? So if you're going to do any massage or adjustment, you would do that now. So let's assume we finished that, and now I want the patient to go face down. Now you come down toward, as a practitioner, because of this table, and he's so tall, I'm going to actually get up on the table to show you these points because they're higher and further than I can reach. All right? So you're going to hit, there's a motion that's up and down and in and out. So left hand is counterclockwise, right hand is clockwise. But it's down, 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 and circular. So it takes a little bit of time. Now I do these points approximately 20 seconds. You can do them a lot longer if you choose. You can do them up to a minute. I'm not sure I would do more than that. So then you come down to where the gluteal fold and the leg join, and it's the same motion. Then you go halfway between the gluteal fold and the back of the knee, and those points, still it's a up-down motion, left hand counterclockwise, right hand clockwise. How's the pressure? Perfect. Some people are ticklish, and you touch these points and their heels will come straight off the table. You don't want to be leaning over with your head. I had one lady who had leg disease, and I hit these points and her heels almost knocked me out. So I've learned to reach out and do these points, or I'm sitting, so if there was some movement of the leg, it wouldn't create pain for me. All right, so then the next point is behind the knee. The most relaxing point I have ever found in the human is behind the knee. Same motion. If you do this for 3 minutes, they will have one of the deepest sleeps they've ever had. So if you have the time, you can amplify the treatment. What I'm showing now is about a 20-minute treatment. But if you add 3 minutes on this versus 20 seconds, then you move to the middle of the calf. Same motion. Okay. The next points are the Achilles Tendon. Yogi Bhajan said this is the most powerful 3 inches in the body. He didn't say why, but I do this motion of down, up, back and forth. So you're like milking the Achilles. See that? Okay. And I will do this on some patients. If they're mentally foggy, I will do this for up to 3 minutes. And the mental clarity that comes is amazing. And they'll feel it. Most of the time I will do this, I will count to 100. So 1, 2, 3, 4, 5. It's fairly fast. So I'll do this for about a minute versus 3 minutes. Now, I will warn you, if you treat your partner and then you expect them to treat you right after, they may be, oh yeah, I'm going to have the energy for that. And it gets so relaxed. You have to try to train yourself to really be available. I'm now taking my thumb on the inside of the heel and I'm massaging those points. Very much ovaries and gonads. And it's a rather in, out, left, right circular motion with your thumbs. Almost any movement will work on this one. But it's definitely opposite, back and forth. Now, the next point is called kidney 1. And you sort of draw a line right down the middle and where your finger just naturally wants to stop. Knuckles, back and forth. Usually people, this is a very sore point. How you doing?
Not too bad. It's a little painful, but not too bad. The one in the heel actually was a little more painful.
Okay.
Yeah, that one.
All right. So now I'm going to ask the patient to turn over, upright once again. And now you're going to milk the toes and the fingers. As a licensed practitioner, I can pop the toes. You may want to avoid that, and some people's toes are extremely painful. His move easy. Once I've popped the toes, then I move to this side again. And I'm going to take his hand, I'm going to now elongate the fingers. Sometimes they'll make noise, sometimes they don't. At this point, I have developed what I call the ending to the treatment. I just put my hand over the navel, and I put my hand on the back of the neck, and I can feel a pulse. This was not part of the treatment, but I have found that if I can synchronize the sense of what I feel under my left hand and this hand, I can clearly connect the navel to the upper gland. So I go right behind the neck for the 5th center, then middle of the top of the skull for 7, and then the 3rd eye. At that point, the treatment is finished, and you want to let the patient know how you feel.
Great.
Good, we're done.